And action. Bruce had a question on Patulous Eustachian tubes. And essentially the symptom that is associated with that, PET, is autophony. That's when you can excessively hear your voice, your breath, your pulse, and it gets to the point where it's actually very distracting to sleep and to activities of daily living. If you watch my video, DrRic Tutorial Stuffy Nose, I talk about Eustachian tube dysfunction. In Patulous Eustachian tube, it's more of a constant opening of the Eustachian tube versus Eustachian tube dysfunction, which is usually closed. But I have drawn an illustration to kind of guide us through this thing. So here's the eardrum, here's the ear, here's the external auditory canal where you're not supposed to put Q-tips down. Then it ends in a cul-de-sac with the tympanic membrane or eardrum. And the eardrum is supposed to be thin like cellophane, so that when sound waves come through, the sound waves will vibrate that cellophane eardrum, and the vibrations would be transferred to 3 tiny bones or 3 tiny ossicles in the ear, and then that would send an impulse to the brain via the 8th nerve. Now this drum vibration, it can only work, number one, if there's an access, there's nothing blocking up like a ball of wax, nothing blocking up the external auditory canal. Number two, if there's no fluid in the middle ear infections produce pus and fluid, not supposed to have that much fluid, and when there's fluid, it'll dull the movement of the tympanic membrane. Number three, the Eustachian tube, which ends in the back of the nose, is supposed to be open. Now, it's not supposed to be open all the time. It's supposed to close selectively. That's part of that is based on the fact that there is cartilage that kind of lines 2/3 of the tube. That's illustrated over here. I mean, you can't have cartilage that constantly holds it open. You have to have it kind of partially open and then tissue on the other half to allow a little bit of collapse. You don't want it open all the time. And there's muscles above and below the levator veli palatini and the tensor veli palatini that kind of control the movement of the cartilage and the buoyancy, the springiness of the cartilage, so that it stays open or closed, depending on which muscle is being stimulated. So, in addition, if the lining of the nose is swollen and stuffed up, it too can kind of block up or make it excessively open. That's why sometimes people who lose massive amounts of weight suddenly will lose body fat, and that's good. They'll probably lower cholesterol and sugar. But sometimes with PET, if you lose too much weight, there's no fat in the lining of the nose, and the hole will open up aggressively and stay open all the time. That's one of the theories. The other theory is also using decongestants or antihistamines will also dry up the lining so that there is no suppleness to the tissue. If there's no suppleness, it just kind of stays rock hard open. Even if the cartilage is soft, you'll still stay open. And you can't have that tube open all the time because it will change. I'll demonstrate in a second. It'll change the way you hear things. Also, I believe that if the tympanic membrane has been scarred with multiple infections and is excessively thin, it too can vibrate aggressively. That's not really a Eustachian tube problem, but it's more a thinness to the tympanic membrane. There's also problems with the mastoid bone back here. If you've had multiple infections, the bone will be eroded. The cavity of air there is also important to this bony part. So the cartilage is important to this part of the Eustachian tube. The bones are important to this part of the whole ear complex. And if the bones are screwed up, soft, not working properly, they too can have cause a problem with autophony. So sometimes what we'll do is look for infection. We'll look for excessive movement when you come into the clinic. Usually it means closing off one side or another, blowing or inhaling back and forth, sniffing. And if we see that the tympanic membrane moves aggressively, it's not supposed to do that, that might lead to a working diagnosis of PET. You always have to make sure that nothing's obstructing the nose, so we can see in the clinic, in an average clinic, we can see to the probably the front or the anterior 2/3 of the nose, but it's hard to see the Eustachian tube opening, so you'll have to go to see an ENT doctor to actually put a scope in here and watch and observe the opening. In many cases, when you have this disease process or this excessive amount of autophony, it can be very disruptive with life. So a lot of people have tried as best as possible to see as many specialists as they can, but unfortunately the treatment plan is limited. In some cases, depending on which is the more dominant problem, the tube or the tympanic membrane, you can put a hole or a tube through the tympanic membrane and kind of diffuse or decompress the lining. It might take care of a certain decibel, but it won't take care of everything. Again, some of these folks are suffering so much that they'll just go for anything possible. I've heard of people lining the tympanic membrane if it moves aggressively with cream. But there's also using nasal sprays that are boosted with estrogen. I've heard people using potassium iodide. The results are kind of mixed. There's not surgically wise, medicine wise, estrogen sprays through the nose, which you can get if you find a compounding pharmacist. I use Wholesome Health Pharmacy in Hoffman Estates, Illinois. And then the guys over there, Matt is the owner, but the guys over there can make up a component, if you can get your doctor to write a prescription, that would be me, for an estrogen spray. I think that an estrogen spray is relatively safe if you use it for about 2 months, 1 to 2 months, just to see if some of the symptoms will improve. I really think that increasing the fat in your diet, not necessarily going back to bad fats, but omega-3 fats, flax, fish oil, krill, I think by introducing more fats, you will plump up the lining a bit. Staying away from decongestants and antihistamines are also important. But doing this during high allergy season, you're going to be suffering one way or another. I would still also usually try to have, I like neti pots, nasal irrigations. I think that it keeps all the crap that you're exposed to in our daily environment out of your nose. So it will help with taking care of inflammation. Again, that's more with Eustachian tube. PET or Patulous Eustachian tube is a little different, but still, if we want a proper functioning lining of the nose, if we're going to start anywhere. So this is a drum. This drum has an eardrum on the top. It has an ETD in the middle. So for all intents and purposes, think of this as your eardrum. Think of this area has the external auditory canal, and think of this as Eustachian tube. So if I bang a sound, it's been perfectly tuned by somebody in Puerto Rico to sound that way. If I screw up the Eustachian tube and block it, it changes around the tone. Let me see if I can do this a different way. So if I block off the Eustachian tube, it gets screwed up, right? So also, that's that picture I was showing you before. Also, if I change around the tension to the tympanic membrane or eardrum, it'll change around the tone. So hopefully you can pick that up. But it changes around. So changing around the tension. If I put a hole in this one, I'm not going to do that. If I put a hole in it, it'll also change around the decibels that you can interpret. So blocking up the Eustachian tube will screw it up. Changing around the flexibility of the eardrum will change it up. And obviously if I change the dynamics of the room, fill it with smoke, or use a bigger drum, it'll also change the way you hear the sound. And sometimes if it's perfect, again, if an instrument or your ear is perfectly tuned, then you can make great music. If it's not perfectly tuned, then suddenly music becomes irritating. And you can imagine, you probably can't imagine if you haven't experienced it, but imagine going up into a plane, coming back down and having that fullness, the difficulty with hearing. Or putting your finger in your ear and trying to talk to somebody and trying to read their lips because you can't hear properly. Or plugging up the nose and trying to sing. You change around the dynamics of the way sound is produced and voice is made. So all this hopefully will give you a little bit of an understanding, Bruce, that there is a problem. It's not just a stuffy nose or an ear infection. And certainly take care of those things if it's the issue. If we're using things like decongestants, caffeine, alcohol, all those things that cause excessive drying and excessive urination, antihistamines, we might want to stop that. Cutting back onto too lean of a diet probably should be liberated for 1 to 2 months. I wouldn't say go back to crappy food, but increase those omega-3s. I think essential oils are very helpful. Sometimes if you can get the essential oils to the lining of the nose without causing harm, that would be great. Essential oils in a diffuser in a room is one thing. Essential oils and estrogen in a nasal spray would be another, but you have to have that cleared by your doc and then made by a compounding pharmacist. Again, check out or call up Matt at Wholesome Health Pharmacy in Hoffman Estates. He can give you some information. There's other things that might be tried, but like, for example, speech lessons. I think speech lessons will change around the way you work the muscles inside. I talked about the TVP and the LVP muscles that change around the way the cartilage moves. Well, you can't necessarily change those two tiny muscles alone, but because the muscles that take care of the neck and the voice are all going to pull on that same, all be pulled at the same time, sometimes by changing posture, changing around you, the way you sound with your voice, changing the strength of your voice will always help. So it's worth a try, especially since with PET there's hardly any treatment plans anyway. So don't get frustrated, but keep on chipping away. We'll get the reasons discovered and we'll get the treatment started.